With the advent of new treatments in oncology, such as immunotherapies, imaging approaches in oncology clinical trials and in disease diagnosis and monitoring are advancing with the integration of technologies such as artificial intelligence. Xtalks spoke with Dr. Edward Ashton, Vice President of Oncology Imaging at Phillips BioTel Research, for insights into the latest advancements in oncology imaging. Have a listen to this Q&A with Dr. Ashton in this video.
Absolutely. There are a wide range of imaging techniques that are used in oncology in both the clinical setting and in clinical trials. Some of them are really well suited towards looking at changes in disease state over time, and those are the ones that we would look at in terms of assessing progression. The standard method, of course, is computed tomography, which is ideal for looking at changes in tumor size and tumor burden in patients, which is the primary measure that we use in terms of assessing whether a patient is responding appropriately to therapy. In terms of diagnosis, we're often really interested in distinguishing between malignant and benign processes that might look very similar on a CT scan. And to do that, we frequently turn to molecular imaging. So we look at positron emission tomography in particular, which is able to look not just at the size and shape of tumors, but at their biological activity. For instance, fluorodeoxyglucose is a trace which allows us to look at the glucose metabolism of tumors, which is one of the things that really distinguishes malignant tissues from benign ones. We also have a number of specialized tracers which bind to proteins which are characteristic of different tumors. We're able to train AI systems on particular types of images with keys. So for instance, if we're looking at a segmentation problem, looking at identifying normal tissues, looking at identifying the brain, we can train one of these systems by showing it lots and lots and lots of brains with the appropriate structures identified. And then based on that, the system can learn to identify the brain on future scans. That becomes much more difficult with cancer because with cancer, we're not really looking at a particular thing that shows up in a particular part of the body. Of course, we're looking at an abnormality that can show up anywhere and can take on many different forms, many different types of morphologies. And as a result, you can in principle still use these systems to do detection and segmentation of tumors, but you need a much, much larger data set. You might be able to get effective segmentation of the brain with maybe a couple of hundred well-segmented brains as a training set. To do the equivalent thing for instance, brain tumors, or for even broader tumors within the body, within the torso, for instance, you might need thousands or even tens of thousands of training sets, all of which have been completely segmented by hand, and that becomes a much, much more difficult problem.
Hear more from Dr. Ashton in a series of webinars on imaging in oncology. For more information and to register for the free on-demand webinars, click the links in the description below. BioTel Research, now part of Phillips, provides cardiac safety testing and medical imaging services supporting clinical trials to pharma, biotechs, and CROs. For more than 25 years, trial sponsors have relied on the company's scientific leadership to help design and optimize protocols and statistical analysis plans across a host of therapeutic areas. Visit Xtalks.com for more information for all your life science, medical device, and food industry news and webinars.